And we do share these recordings out for the FPHS Showcase in our newsletter that follows. So if you are not subscribed to our FPHS newsletter, we'll share details with how you can get on the list for that so you can take a look at our past sessions. We just recently sent out our July recap that went through maternal health issues in regards to high blood pressure. So be sure to check that out. For legal issues, DPH contracts with the Massachusetts Association of Health Boards, MAHB, to provide answers and guidance to health departments and boards of health on a wide range of public health issues. MAHB produces documents and provides information on these webinars for educational purposes only and are not to be construed as legal advice. If you have any legal advice, please contact your city or town attorney. Just a couple housekeeping rules as we get started here today. We do have the webinar function, the Q&A set up for questions for our speakers and panelists. Feel free, that is just in the bottom toolbar there. We also have the chat enabled for this meeting. Look for the little speaker bubbles in the bottom toolbar. We just remind you, please be respectful, empathetic, and mindful as you're putting comments in there. We encourage a dialogue among our local public health professionals and our speakers and panelists. And also for accessibility purposes, if you need captions for this webinar, you can click the Show Captions button on the bottom of your Zoom app. And if at any time you're having technical issues, please email us at localregionalpublichealth@mass.gov, and we have team members on the back end here from OLRH who can help support you. On today's webinar, we're really excited to have a panel discussion with our partners from the Immunization Division. Kathryn over there from North Suffolk Public Health Collaborative, we have Lori, and from Tri-Town Health in the Berkshires, we have Jill Sweet. And joining me as co-facilitator, I have Chief Clinical Advisor to Local Public Health, Caitlin Pettengill. And I'm Christina Relation Finnell, Senior Engagement Coordinator with OLRH. Today's agenda, we are going to jump in first with Kathryn looking at DPH's Immunization Division, and then we'll jump into our first community story, looking at Chelsea and Revere with Jill, and then we'll go into our second community story covering the Southern Berkshires with Lori, and then we'll join up for a panel discussion and Q&A, and then we will wrap up for today. Just a reminder, this is for our foundational public health services. The areas and capabilities in today's session that we are covering are communicable disease control. And then for foundational capabilities, talking a lot today about community and partnership engagement, equity, as well as communications in regards to vaccine access. So we are going to kick it off first with our spotlight presentations, and I'm excited to turn it over to my DPH colleague, Kathryn.
Great. Thanks, everybody. Good afternoon. My name is Kathryn Ahnger-Pier. I am the Associate Director for the Immunization Division here in the Bureau of Infectious Disease and Laboratory Sciences. And I'm going to give a brief overview of our division. Next slide, please. So I could talk for a long time about all the different work that our division does, but after I give a brief overview, I'm going to go into a little bit more detail about one of our units, our data assessment unit, and then one of our projects, the Vaccine Confidence Project. Next slide, please. So this is a very rough org chart of our division. We have approximately 50 staff members, mainly state employees, but we also have some contractors as well. And not everybody fits into one of these 6 buckets, but this is sort of the big picture activities that we do. Division administration is fairly boring. That's myself and my director, Peshman Talibian. So we're going to focus on the main 5 where all the work gets done. And if you go to the next slide, please. Most of you, when you hear immunization division, probably think of the vaccine management units. This is the group that handles all of our vaccine for our state program. You enroll in our program, you order vaccine, you get vaccine, you have to send in temperature logs, there's site visits, there's trainings, and that's sort of the provider-focused area of our division. And I'll pause here for just a note that while we typically refer to ourselves as the vaccine program, there's actually sort of three parallel programs that are in play. The first is the Federal Vaccines for Children program, which provides free vaccines for kids who do not have health insurance, Medicaid, or are American Indian Alaska Native. We also, in parallel, run a universal program for everybody else. So with those two programs combined, all kids 18 and under can receive vaccines from us through their providers. So if you are interested in perhaps providing pediatric vaccine, we are encouraging local boards of health in collaboration with larger communities. So maybe not necessarily just providing vaccine for your one community, but providing vaccines for multiple communities within your region or your shared service arrangement. But this is just one component of our immunization division. And I will also mention we have a very limited adult vaccine program. This is only for uninsured adults for most, but not all, of the routine adult vaccinations. We're hoping to expand this at some point in the future, but for right now, it's fairly limited. So something else to keep in mind, if you have a high number of uninsured adults in your community, you can receive some vaccine from us for them specifically. So next slide, please. We'll go into the rest of the division. We have a phenomenal clinical nursing unit, so we're on the call today. We have 6 nurses who provide clinical support to providers. The bulk of the work that they do that takes up a lot of time is the perinatal hepatitis B prevention project to ensure that individuals born to hepatitis B positive individuals are not infected during the birthing process. They have a really great success rate with that, and that's a really important work that they are doing. They also participate in quality improvement activities for our pediatric vaccine providers to ensure that the conversations that they are having with parents, with their kids, are as good as they can be. And they are also available for clinical questions around vaccination. And a lot of weird scenarios come up where somebody might have gotten the vaccine too early, too late, the wrong type of vaccine, and they are very good about working through with the asking clinician, what exactly can we do in that situation? We'll have these slides available afterwards, and we have the contact information for all of our nurses in that slide as well. So feel free to reach out. Next slide, please. So I'm going to do more information about the Vaccine Confidence Project in a little bit, but that resides within our education and outreach unit. In addition to working on the Confidence Project, they also handle most of our public facing materials and also the materials that we send out to providers. They maintain our social media posts whenever it's National Hepatitis Awareness Week or National Immunization Month. They will deliver social media posts around those particular activities. And they also provide coordination with our vaccine coalitions of our 2 annual provider conferences that occur. One is in the spring, that's our adult-focused immunization conference. And then we have one in the fall, which is our pediatric-focused immunization conference. Anybody from local board of health, welcome to attend, particularly if you administer vaccine. Our pediatric conference is going to be on November 5th at the DCU Center in Worcester, and the registration just recently opened up for that. So we can send more information about that as well, if that is interesting to you. Next slide, please. So then I'll also talk a little bit more about our data assessment unit, but this is where our epidemiology team sits. So if you are thinking about immunization data or coverage rates or how are we doing with schools, all of that data flows through the assessment unit. So they conduct our school survey, they help out with the provider quality improvement activities, they can analyze data from the MIS and from other sources, and they also develop dashboards and other epidemiological activities. They're the team that come up with our respiratory vaccination dashboard each year, and they're also able to help out with any sort of coverage questions that might come up as well. And the next slide. And then finally, we have the Massachusetts Immunization Information System. If you are giving a shot to somebody in Massachusetts, it has to get reported to the MIS to create this lifetime registry for an individual. We also have a public-facing immunization portal called MyVax Records. This was rolled out during COVID when it was important to know what your COVID vaccine history was. But we can also provide other information that's in the MIS for your other routine vaccines. So that's been very useful for people who need to get records. The system also supports the vaccine management module and our school survey module in addition to the registry. And there's many reports that are available for providers to use in order to run different metrics on how they're doing immunization-wise. If you are a provider who administers vaccines, you are able to run reports around the number of vaccines you've administered and to do reminder recall reports on your patients. But boards of health are also able to run coverage reports for their entire municipality if they're curious on how flu rates are looking like in their community or other vaccines. Next slide, please. Okay, so that was a quick overview. I could probably talk for a couple of hours about any of those different projects. I'm going to focus a little bit more on the data assessment unit. Next slide, please. So the first and foremost is this sort of near and dear to my heart. This is what I worked on when I first started DPH many years ago, is the annual school survey that is completed. We survey childcare preschool programs, kindergartens, grade 7s, now grade 12s, and colleges to assess for compliance with immunization requirements for school entry. These data are generally collected in the fall with a hard deadline sometime in January. And then as soon as we are able to appropriately clean and present the data, we put it on our website. The website is listed here. We also have data going back to about 2014, 2015. So we have a number of historic information as well. We also post by school and by county. Next slide, please. This is an intentionally overwhelming slide just to show a little bit of the vast amount of data that we have on our website. At the top, we have our kindergarten data by school. I just want to point out that we do survey both public and private schools, and we have different notations for schools that either do not complete our survey or schools that complete our survey, but the number of students within that particular grade are fewer than 30. So due to our privacy regulations, we are unable to post that data publicly. So feel free to look at that, take a look. Let us know if you have any questions. On the bottom left is one of the maps that are located on that website that show by county. This map is showing proportion of students who are not meeting school requirements. So they don't have the required vaccines, they don't have an exemption. There's lots of different reasons why that might be the case. And then we also just have a table here about our immunization and exemption rates by county. So wealth of information here. Feel free to take a look and let us know if you have any questions about any of that. Next slide, please. For the last few months, the data assessment unit has also been working with several shared service arrangements to come up with a municipal level vaccination estimates. And these have been generated from a couple of areas. So the top table here, and this is from the Metro West Shared Public Health Services. So apologies if you're from that area. I'm picking on you a little bit, but that was the easiest data I had available. So on the top table is the data that's within the MIS for kindergarten age children in those communities. And then on the bottom is the same communities, but what we've received from the school survey. So we can use this as a starting point to determine if there's any particular areas of need, if one community perhaps has less access to vaccinations than another. And we can talk a little bit about some of the limitations of our data, talk about the needs of the particular communities for your community best. And the assessment unit is available to have consultations regarding coverage estimates and what you might be seeing in the MIS and what we might be seeing with our school survey as well. Next slide, please. The assessment unit was also very key in, along with some of our other staff, in participating in school-located vaccination clinics, which occurred throughout the winter and spring of the school year. We focused on 3 districts in Springfield, Worcester, and Brockton, and in collaboration with those school districts and the boards of health in those communities, we were able to vaccinate 442 students with just over 1,500 vaccinations. And the thing that comes and strikes me the most about that is how many students needed multiple vaccines. So there are definitely areas where people are under immunized, and they may not just be missing 1 or 2, but they are missing a slew of vaccinations. So this really sort of highlights the needs that might exist in pockets in different areas of the state. Unfortunately, we don't have money to run our vaccination program, our mobile vaccination program, either in schools or for our flu COVID, which we had been doing for several years. So what we are doing is trying to create a best practices document for those who are interested in operating their own vaccination clinics in their communities, using some of the lessons that we have learned and additional work from the boards of health that we have worked with in the past to try to assist anybody else who is looking to do their own clinics. Next slide, please. Okay, so that was the assessment unit, and then I'm briefly going to cover the highlights of the Vaccine Confidence Project and hopefully encourage many of you to participate in this project as well. Next slide. So these are a couple of the slides that I borrowed from their main presentation. The Vaccine Confidence Project was formed in 2018, had a little bit of a pause while COVID was happening, and now we're trying to bring it back as much as we can. It's a collaboration between us at DPH and our two main immunization coalitions, the Massachusetts Adult Immunization Coalition and the Immunization Initiative of the Massachusetts chapter of the American Academy of Pediatrics. Next slide. But just because it's the three of us, there's actually multiple different partners that we are reaching out to across the state on a variety of areas to try to reach vaccine confidence across as many different vaccines, age groups, and populations as possible. Definitely among them are the Association of Public Health Nurses and our local Board of Health resources as well. So we strongly encourage you, if you would like to become more involved in this, or you're also looking to get more involved with some of the partners that are listed here, definitely feel free to reach out to us. Next slide. We have a nice looking website, which contains predominantly a lot of evidence-based resources and a searchable database. So if you're interested, or you have somebody come and they are asking you about vaccine hesitancy and a topic that you're unfamiliar with, we probably have something related to that on our website. So you can go and you can take a look at that. We also keep a rotating list of our upcoming vaccine conferences and webinars. We also have some archive webinars there as well, if that's something that you would like to explore. And then we also have the ability to sign up for our quarterly newsletter on that website. Next slide, please. This is an example of that newsletter. The newsletter which comes out will include the most recent evidence-based resources, anything that might be happening locally, timely, if there's something that has been happening over the past couple of months, any additional training opportunities we want people to be aware of. Here are the webinars that are available. We do also create some special editions as well. So the image that's here on the slide is our respiratory illness season special edition that comes out specifically related to that. So if you sign up, you'll be able to get that in a couple months. We also came up with a measles update, not outbreak. We don't have any of those yet. We also had a measles update that came out earlier this year that contained measles vaccine specific information around vaccine confidence. Next slide, please. This is one of those documents that's available on the website, which is really nice. It's a communicate with confidence, talking with patients about vaccines. It's a very dense, summarized set of vaccine confidence resources all on one page. And it covers a number of different areas, such as where do I go for trusted information? How do I start having that conversation with a particular patient or parent if they're concerned about certain things? What if I have a special population that I'm worried about? And so this is a really great place to start if you're not really sure where to go. Usually starting here is either going to give you the information or point you in the direction that you would like to go. Next slide, please. And then finally, when it comes to, we try to have as many educational opportunities available as well. And we run an immunization update in the spring to cover new updates that are happening in the immunization sphere. We always try to focus on vaccine confidence and what's new there. The 2025 version was actually presented on by some of our public health nurses. It's a really excellent webinar. It's an hour. The benefit of getting to it recorded is that you can stop it if you need to. But this is a really wonderful webinar and really wonderful opportunity to learn a little bit more if you're interested. And we have this link on our mass.gov website and also on the MCVP website as well. Okay, next slide. So that's all that I have for you today. Feel free to type in any questions that you might have. I'm including the contact list of the staff in the data assessment unit, their email, and they have a phone number which you can call and leave a message if you would like to reach out to one of them. And then we also have our vaccine confidence project leads. So Pam, who's here at DPH, Cynthia at the Mass chapter of the AAP, and Rich, who's at the Adult Immunization Coalition, if you would like to learn more or get more involved with that project. Thanks.
Excellent. Thank you, Kathryn. Really appreciate that. We do have a question here in the Q&A from Sean, and it looks like we have some time that we can get to it. And so Sean's writing, a group of us are interested in what vaccine we can provide to VFC eligible children, adults 19 and older, and adults under the age of 65 without violating federal guidelines. There is a growing interest in vaccines for adult flu, COVID boosters, measles, shingles, and pneumonia. Oops, and I don't know if you're muted there, Kathryn.
That's what happens when you're jet lagged. Apologies for that. So I will just repeat what I said. I don't have it up in front of me, but I will grab it. The adult availability table. So for adults who are 19 and older, um, the the list of vaccines that are available, it is most of them. Again, that's for uninsured adults. So any adults who do have insurance, that is something where the vaccinating provider would need to purchase vaccines themselves and administer and then get reimbursed from that insurance, be it Mass Health or the commercial insurance. It's only in the event that somebody is uninsured that we're able to provide that state supplied vaccine. But I will find that table and I'll put it in the chat. For children, if you are an enrolled provider with us, it is all children 18 and under can receive state supplied vaccine, and we are fully universal. So all of the vaccines that are routinely recommended, including flu, including COVID, we'll be able to send that to you to vaccinate your pediatric population. The restriction really is just for the adults, and we know that that is a pretty big limitation. But if you have any questions, you can also reach out to us or the vaccine unit as well, and we'll be able to assist you with that.
Awesome. Thank you. Kathryn, I'll leave that one open in the Q&A for you. So if you want to pop in any further resources there for Sean. And then we also have a question from Olivia asking, is Mass Medical Society a partner? If not, please reach out. And then Sean just has a follow-up. CVS is concerned that we won't be able to vaccinate healthy adults and that they will be overwhelmed.
That is something that I knew that we were going to be talking about COVID at some point, and unfortunately, we don't have any recommendations right now. So we are a little bit hand tied in terms of the guidance that we're able to give because I don't know what it's going to end up looking like. But I definitely hear your concern. And as soon as we know more, we'll be sure to send that out around to everybody.
Awesome. Well, thank you, Kathryn. And Kathryn's going to be hanging on for the rest of our discussion today. So if there's anything else that still pops up, please feel free to put that in the chat or the Q&A. But otherwise, now we are going to turn it over to Jill Sweet from the Berkshires to go over a little bit of what they're doing out in Western Mass. Jill?
Hi, everybody. Sorry, my camera's not working. So I'm part of the Southern Berkshire Public Health Collaborative. I'm the lead public health nurse. Next slide, please. So we call ourselves a collaborative or a partnership of boards of health within the towns of Alfred, Great Barrington, Mount Washington, Monterey, New Marlboro, Otis, Sandusfield, Sheffield, Tyringham, and the existing tri-town district towns of Lee, Lenox, and Stockbridge. There are many miles in between our towns. It's really amazing the amount of time we can spend on the road visiting each of these towns. Next slide, please. So our team consists of Jane Smith, who's a registered sanitarian. She is our shared services manager, myself. Denise Cox, she actually joined us last year as a per diem nurse to vaccinate at our clinics, and she is now with us part-time. She goes out to 10 of the 12 towns to offer wellness sessions, mostly at the senior centers. But, if anybody younger population that pops in there, she does, provide blood pressures, does a wellness topic each month. And yeah, she's a great addition to our team. And then Jason Dragonetti, he's a shared health agent. He covers the towns of Sandusfield, Mount Washington, and Sheffield. in addition to offering public health nursing services, I do have a robust car seat program. I've provided, a couple hundred car seats throughout Southern Berkshire County. In the beginning, when I became a certified car seat technician, I was the only one in Berkshire County, so I was going anywhere from Adams down to Ashley Falls. So it's a great service, able to provide car seats to those families in need. Next slide, please. So this is our flu and COVID clinic for this upcoming fall season. We have 17 mobile clinics, and we're have a very robust in-home vaccine program. As of yesterday, we are up to 83 individuals. That includes the person that has mobility issues, homebound, and their care provider, whether that's, a family member or they have somebody that comes in and helps take care of them. We're also offering office hours. So if one of our clinics doesn't work for somebody, especially a working population, we can meet them when what works for them. We do use color for registration and billing. So that's huge for being able to be a sustainable program. Next slide, please. Jane was nice enough to put together these little figures for us over the last couple of years. You'll see this year, fiscal year 25, we did have some big purchases. We were using 3 different vaccine refrigerators, which was kind of crazy. They were all different sizes. So we did purchase one very large one. And we also purchased a vaccine freezer so we could offer varicella as part of our childhood vaccine program. And we also purchased 4 vaccine coolers, transport coolers for all of our clinics. Next slide, please. We are a vaccine provider for children. About a year or so we've been that. Next slide, please. So currently, these are all the vaccines that we are providing. Not sure about COVID this year. We'll have to wait to see what the final recommendation is. Yeah, we'll see. Next slide, please. And so one of my goals this year was to get the word out that we are offering all school required vaccines. So this is a flyer that I made up that's going to go out to the schools, daycares, because around here we do have a shortage of primary care providers, and it can be quite a wait for kids to get in to at least get their vaccines. So yes, this is going to be going out when school starts, which is actually this week. Next slide, please. So currently I'm working with the school nurses in 2 out of the 4 big school districts here in Southern Berkshire County. That all started when I needed my daughter's vaccine record because she was going to be an LIT at a local summer camp last summer, went into MIS to print it up, and the only thing in there was her flu and COVID vaccine. So I called the pediatrician's office and I'm like, hey, what is going on? And they were not transmitting vaccine records to MIS, which is a huge problem. So when you look at, I bet you if you pulled up any kid in Southern Berkshire County, it might look like they're under-vaccinated or not vaccinated at all. So what I've been doing is working with Berkshire Hills and Southern Berkshire Regional School Districts and inputting those vaccine records. It's a lot of work, but worth it, because when the nurses go and they sync SNAP and MIS, those records are complete and able to, have an accurate reflection of who's missing what. So that way then I'm able to, send letters out to families, letting them know, hey, we're a vaccine provider, you can contact us. And also the opportunity to vaccinate high school and middle school kids during the school day with parents' permission with a signed consent form. The school districts have been great about working with us to, make that happen. That way kids aren't missing school, missing important classroom time. In March, Jane put together a webinar regarding measles. I was out on medical leave, so I thank her for putting that together. Work with Berkshire Health System, local pediatricians' offices, school nurses, other public health nurses, boards of health, to talk about what happens if we get a positive case of measles. What does that look like? So that was a great discussion. I'm sure there's people that are on this call that were part of that discussion, which then led to offering an MMR clinic at one of the school districts. Got some kids up to date, got some of that population age range that they, never had it or only had one dose. So they got their second dose of MMR, which is great. So hopefully, if need be, these people are covered, and if there's, God forbid, a positive case, that they'll be covered. And then we also share vaccines with Volunteers in Medicine. They have an office in Great Barrington and a new office in Pittsfield, and they serve the uninsured adults 19 and older, large immigrant population. So they need flu. They've recently had some kids that were going off to college or uninsured, needed, the meningococcal. So we're able to, get them those vaccinations as needed. Next slide. That's it. If you have any questions, please put them in the chat.
All right. Thank you so much, Jill. I have been seeing that there has been some questions in the chat that Caitlin has been getting to, as well as Kathryn. Caitlin, I want to see, did you have any questions right now for Jill about her work in the Berkshires?
Jill, you're doing such a good job with this program. I just wanted to ask you when you started this program for everyone who's unaware.
When did we start? The overall, back in 22, I believe.
So
Yes.
this is a really impressive program to have implemented in this short amount of time. And I just give you a lot of credit for everything you've done.
Thank you. Yeah, we came to VFC provider last year in 24.
Can you tell us about the community partnerships that you made with schools and with other partners, and what else has blossomed outside of vaccines because you reached out and made the connections through the vaccine program?
Right. So the car seat program, that's huge. And then our in-home vaccine program, I think when we started this endeavor back in 22, I think I had maybe 30. And so just yesterday I added 4 people to my list. People are just so thankful that we are able to come to their home, and I let them know, not only can I vaccinate who needs it, but whoever else is in the home. It's just huge. It's because sometimes it's just a hardship for people to try to get those vaccines.
Can you tell us about how you made the connections with the schools?
The school nurses. I was a school nurse, so I do have those connections. And yeah, just having that background as a school nurse.
How do you think that if there were to be a situation in the future where you need to work closely with the schools, so for example, in the recent past during the COVID pandemic, public health needed to work very closely with schools and with school nurses. How do you think this program would assist in that?
I think that we would, oh gosh, this is a good question. Definitely a conversation to make sure to include the superintendents, because they're the ones that would get the word out. Pediatricians' offices, there's only so much that they can do. I just reached out to one of the pediatricians' offices today because I found out they don't have meningococcal vaccine. I'm like, well, I have it. Let me know. I think it's just keeping those open lines of communication and keep collaborating with them, and just trying to make things easier for parents too.
So it sounds like you have robust community partnerships with all these different key stakeholders.
Yes. Yes.
Something that you did that I thought was so cool that I would love for you to share more about was you did a measles debriefing months and months ago with all these stakeholders. And I wanted you to just briefly share with the group, who was invited. Your health director, Jane Smith, ran that meeting. I got to be a fly on the wall. It was so proactive and so awesome. And I just wanted to see if you could just briefly let folks know what that looks like.
Right. I'll try to remember because I was out on medical leave. I kind of sat in the background and was watched the webinar. So Berkshire Health Systems, some of the emergency room doctors, especially from Fairview, were on there, which is in Great Barrington. Um, the pediatrician's offices, Berkshire South, daycares, community health programs, other public health nurses, school nurses, they were all part of that conversation.
So they went through, for the audience, they went through scenarios that could occur if measles did come to Southern Berkshires, and they all just talked through as a group what that would look like at their different facilities, and they talked through issues that may arise. They made each other aware of limitations or strengths that were available in their individual areas. It was so awesome, Jill, and I just give you guys so much credit for doing that proactive public health work.
Thank you.
Christina, do you want to?
Yeah, I think we have. So we have two real quick questions in the Q&A for Jill before we move on. One is from Simone asking, could you speak to the process of parental permission?
Yes. I don't know where I found the parental permission form, but um, oh gosh, I don't remember. That seems like that was a million years ago. I did send letters out to parents explaining who we are, sent them right from MIAS what their children were in need of for vaccines, and they had to. I wish I should have I didn't even think of it to even include the parental permission form. Basically, the parents, filled it out completely. They signed off, and then they're listed of all the vaccines that we offer, and they check off which ones that their child was in need of. And then I have held on to those forms. I don't know exactly what somebody's looking for. I could pass along the example that I have for our parental permission form if they want.
That's awesome, Jill. And we will be following up, as I mentioned at the start of this session, we are recording. We'll provide the slides and all of the resources from all of our speakers today. Again, we'll share that out in our next month's FPHS newsletter so we can follow up. And then just one other question that we have from Megan for you, Jill, here is how can college students access this initiative? I work at a nonprofit that supports first generation college students and would love to provide them this resource if possible.
Are these kids insured or uninsured? I guess that would be a question.
Hi, Jill. Yeah, so I have quite a few students that go to UMass Amherst, and a lot of them are on Mass Health, but some of them, depending on their status, may be uninsured. So, is this a situation where only uninsured college students could access this, or would it be versatile to anyone?
So the VFC is anybody that's 18 years of age and under automatically qualify for the state supplied vaccines. Um, Kathryn could chime in if she can. I know they just upped, I don't know which one it was, for 18 and 19-year-olds going off to college that they could also get state supplied vaccine. I can't think of it off the top of my head, only because I don't deal with a lot of college students. But yeah, I mean, if they're uninsured, they would qualify for or underinsured. I think that's the other wording that they use, that they could get the state supplied vaccines.
Great.
Yep,
Thank you so
that's
much.
also in the adult availability table, which I put into the chat. So we
Yeah.
did update that recently to include 19 and 20-year-old patients seen at public sites who need it. We specifically list out to meet high school requirements, as there are some high school kids who are 19 and 20 who maybe need that meningococcal vaccine to meet the grade 11 requirements. But if they're in that position, probably need it for college as well. That will cover the college dose as well.
Great. Thank you both so much.
All right, thank you again, Jill, and we'll have Jill back for our full panel discussion coming up. But now we're going to turn it over to Lori, who's going to go over the North Suffolk Public Health Collaborative and the work being done on the North Shore of Boston. Lori?
Hi, good afternoon. My name is Lori Fulghum, and I'm the Regional Public Health Nurse for North Suffolk, which includes Revere, Chelsea, and Winthrop. Next slide, please. So a little bit about the history of how we got started. So back in early 2022, we were still doing a lot of COVID-19 clinics, and some of our vaccinators were some of the school nurses. And I just got to talking to them and finding out how many kids in school in our region were out of compliance with the vaccine requirements. And also just kids that were not being able to register for school because they couldn't get appointments for vaccines. And at the time, we were seeing really long wait times to get in to see providers, and families were waiting sometimes months just to register their kids for school. So as a region, we started talking about the possibility of trying to set up some sort of childhood immunization program. And I found out that Malden Public Health Nurse had been running a program. And so she gave me a lot of really good tips and information and told me about the BFC program. And so as a region, we started the process of getting BFC certified and doing the trainings. And we set up our first site in Revere. Next slide, please. So some of the partnerships, obviously, we developed is with the school nurses in the three communities. We've developed relationships with the family and community liaisons that work out of the schools. We work closely with the parent information centers in the school districts. And we also have access to a regional outreach team that was initially an outreach team that was during the pandemic and has since expanded into other activities, and they are very key in helping support kind of the background administration of the program. We also have a connection with Cambridge Health Alliance. One of our community health workers is from Cambridge Health Alliance, and then we also have a connection with them through the regional outreach team. Next slide, please. So our vaccine clinics are by appointment only, and we don't actually allow self-registering, and this is mainly because we need to be able to control inventory, and the majority of the families that we're dealing with are brand new to Massachusetts and often brand new to the United States, and they don't actually know what they need yet. So our vaccines are free of charge. We don't charge any administration fee either. We do use the Color platform for appointment management. And as I said, we started in 2022, in the summer of 2022 in Revere. And then in the summer of 2023, we expanded to a second site in Chelsea. So we are currently running clinics 2 days a week in our region. And some of the ways that we get appointments made is through our regional outreach workers. The nurse at the PIC in Revere is able to make appointments. The lead school nurse in Winthrop is able to make appointments. And then our community health worker in Chelsea also makes appointment, as well as myself. And basically our goal with this vaccine program is to reduce barriers or kind of eliminate barriers to vaccine access for our community. Next slide, please. So a little bit about our patient population. Since 2022, we've vaccinated almost 1,400 children. As you can see, the majority of our families are Latino, Hispanic, Spanish speaking, followed by Haitian Creole and Arabic. We vaccinate generally kids 5 to 18, and although we do get some 4-year-olds as well. We do have staff that has multilingual capabilities, both our outreach workers and our community health workers. But we've also used language lines at times, both to set up appointments and even during clinic with families that don't have any language that we have capabilities with. Next slide, please. So as you can see here, most of our referrals come from Revere, followed by Chelsea and Winthrop, which kind of correlates with the population of those communities. We also take referrals from outside of our region. We get that's dependent on availability of appointments and our inventory. but we do get calls from other boards of health around us asking to send families. The majority of our kids are VFC eligible from Mass Health, although we do get a significant number who do not have insurance. Next slide, please. So kind of the way our program works, we have a secure online referral form that the school nurses have access to. We also have an inbound line that is manned by our outreach team, and that can receive calls, texts, and WhatsApp. And we found that WhatsApp has been the most popular form for the families that are looking for vaccines. It's something that they're really familiar with. We also get referrals directly from the parent information centers, and they hand out flyers to families that come in and register their kids for school. And of course, we get walk-ins or calls to each of the health departments that our families are looking for assistance with vaccines. Next slide, please. So the way the referral process basically works is we get a referral, we have a secure spreadsheet system, and we maintain 2 spreadsheets for each site, or 1 for each site. And then our outreach team follows up with those referrals. As I said, a lot of our families that we've had are coming brand new to the United States and have not had their records reviewed. And so I do a lot of record review and also creating MIS entries as needed. And then they get appointments scheduled. Next slide, please. So we are part of the VFC program. So we have state supplied vaccines. We basically only stock what is required for school entry. As you can see, usually varicella is our most popular vaccine. That's the one that most kids are missing, followed by poliovirus and Tdap. We also stock flu in the fall, and we have stocked COVID in the past, although as others have mentioned, it's uncertain what's going to happen this year. Next slide, please. So another big thing that we do during the vaccine clinics is resource coordination. Obviously, we provide documentation for the vaccines that we give so that they can provide them for school enrollment. We also automatically make follow-up appointments if they have vaccines that they still need in a series. For the families that come in that don't have any health insurance, we try to get them connected to some organizations in our region that help people get connected to Mass Health. We also do a lot of food resource coordination. We have a lot of families in our communities that are dealing with food insecurity. So we have connections to different programs that we can link them to. And we also try to educate them about some of the primary care options in the region. And as I mentioned previously, we have a connection with CHA that allows us to make direct appointment referrals for families that have Mass Health but have not yet been able to establish care anywhere. We can get them linked in to register and get an appointment there. Next slide, please. So some of the challenges that I've faced with this program is just dealing with differences between the municipalities. There's only 3 municipalities in our shared service arrangement. And on the surface, they seem very similar, but it's amazing how different each municipality is and how different each of the school systems are. So just having to be very flexible in how they interact with the program and how they do referrals with the program has been a bit of a challenge. Also, just managing high and low referral seasons. In general, start of school and into the fall has been a busy season. Also at the beginning of the year, sometimes January and February, we see a jump. I have to say that for 2023 and 2024, we did not experience any low seasons. We were completely booked in both clinics the entire year for those 2 years. Also challenges with inventory and ordering. When we were first starting out with the VFC, they still had a rule that you could only order once every 30 days. So that was kind of a challenge, kind of juggling inventory and referrals and not sure if you could get an order in time. But now they've relaxed that rule, so that makes it a little bit easier. Another challenge that we dealt with is we had several hotels that were hosting migrants in our communities. And so helping with that whole process of evaluating records, we channeled a lot of the families into our clinics, and we also held some offsite clinics at the hotels themselves to help get some of the kids vaccinated and into school. And then currently just dealing with the current political climate is definitely a challenge. We've seen a significant drop off in referrals. And I know that at least in two of the communities I work in, the schools have seen a significant drop in families registering their kids for school because of concern with immigration rates. Next slide, please. And then just a few lessons that I've learned along the way. This happened pretty early on. We realized that the school nurses were putting referrals in, but they had not actually let families know that they were being referred. And so then there was some confusions with the families. And so we had to work on that. And now the nurses always let families know, and it's part of the referral process. Also, a thing that I've learned is it's really important to help educate the families about systems here in the United States. As I said, most of our families are coming from outside of Massachusetts and often outside of the United States, and they don't really understand insurance systems, health systems, all of those things. So we spend a good bit of time helping families navigate and understand the systems here. Another thing I've learned is to make sure I have snacks on hand at clinic. I found out that teenage girls in particular don't like to eat during the day, and they'll come late in the afternoon for a vaccine and not have eaten all day, and it gets a bit problematic. And another thing is just being really accommodating for work and school schedules. One of our clinics has evening hours to try to accommodate families that need to come after work. And we always try to make sure we have appointments open in the afternoons after school so that kids can be seen after school if they're already in school. And that's it. Thank you very much.
Awesome. Thank you so much, Lori. So going to, we do have one question for you from Simone, asking if you'd be able to share what the secure spreadsheet that you're currently using is.
So it's through one of our municipalities. The IT department helped us set it up. I obviously don't know the IT parts of it, but yeah, it is secure with the one municipality. And the form that we use collects the most minimal amount of private information possible, just enough for us to be able to actually call a family and get the process started. But we do try to be really careful with how much information we're collecting.
All right, thank you, Lori. So we are going to now turn it over, bring back Jill as well as Kathryn for our panel discussion. And I think to start off, one of the questions I think that we have from ORH is, can PHE pay for the IT consultation? And Caitlin, I don't know if you can help with that one.
Christina, I actually put that in the chat. I just asked Diana that. We're waiting on the edges of our seats for our colleagues. I think Simone brings up something really cool that Lori did in creating that secure spreadsheet. And I'm very interested if I can share with the group if PHE can provide that. I have other questions for the panel, Christina, if we want to move on and give that information after.
Yeah, sure thing. If you want to start us off with your questions, Caitlin.
Can we set it up so we can see the group? Right now, I just see the slide. Is that just my view?
Let me, you just have to highlight our other speakers here. Just give us 1 second.
Lori, similar to Jill, I'm just so impressed with what you've done since 2022 in this program. The outreach to 1,600 children. To steal the words of Robbie Goldstein, you're truly being the safety net of the safety net with this program. And it's just so amazing to think about the effect that this program has had in getting kids into school who would otherwise be excluded. And it's just so impressive, just very huge work here.
Thank you. I have to say, it's been one of the most fun things I've gotten to do. I really love working with the families.
I really appreciated all the community outreach that you named, all the different community partners. Do you want to talk to other people who may be considering engaging in this type of program and a community partner that has been like essential to you?
I would say, like, for me, working with the schools and the parent information centers has been really key, just developing really good relationships with them, kind of alleviating some of the fears that the school nurses had at the beginning about how this was going to work. But yeah, I think at the beginning there was hesitancy, but as they've seen how it works and how quick and easy it is to get families up to date with vaccines, yeah, we get a lot of good comments now from the Parent Information Center and the nurses that they're very happy about the program.
That's fabulous. Jill, do you have anything to add about a community partnership that you have just found to be essential in this program?
It's the school nurses, honestly. They're so overwhelmed that they can't even keep up. Especially like the high school nurse at Monument, she's just so overwhelmed. The fact that, I can go there and help her out with vaccine records and figure out who needs what is huge. But then it's getting those parents to buy in to be, okay, the public health nurse is going to be at the school. You don't have to leave work. Your kid doesn't have to miss school. It's now working on getting them to buy into this, that we're offering this, and it's a convenience for them.
That's huge. I can only imagine these partnerships could blossom really great work in the future if the time came where you would need to. So what I'm trying to say is you're doing the work now through this vaccine program, but if there was something to occur, you have to develop these rich relationships with these community partners, with the schools. Jill, coming as a school nurse, you were an inaugural position as a regional nurse. When you were a school nurse, what would you do without the program?
I don't know. I didn't even know there was a public health nurse when I was a school nurse until COVID hit. And then I got to know Nancy Slattery really well. We had lots of conversations almost on the daily because parents are like, why can't my kid go to school? That type of thing. So I had even no idea there was such thing as a public health nurse in the area. So, yeah.
This has really changed vaccines in your area then. This
Yes.
program has really changed. There
Yes.
is quite a bit of need across the state. We're encouraging local public health to examine, to do an assessment of your community, of the neighboring communities, to think about creating regional programs. Lori covers 3 towns, 2 of which are cities. Jill, remind me how many towns are in the collaborative?
There's 12.
There's 12 towns covered by your regional program.
Yes.
Just encouraging you all in local public health to think about as a region being able to offer this to schools, developing these partnerships, and then allowing those community partnerships to blossom into more, potentially in the future, leveraging those in a way that is very helpful. When you first,
Sorry, I want to also say, last school year before Pittsfield became a VFC provider, Miss Halls, which is a private girls boarding school in Pittsfield, they had a bunch of international students that needed a ton of vaccines, so I was able to provide those for them, which was huge. So yeah.
that is huge. And shout out to Pat out in Pittsfield. She became a VFC provider. She has raised Pittsfield's pediatric vaccine rate significantly since becoming a provider. So a big shout out to Pat. I hope she's listening. I'll
Yeah,
email
so
her
too.
later if she's not. I would like both of you to give advice to local public health about when you first started out, there must have been barriers and kind of roadblocks, and clearly you worked through them. Is there any like pearls or tidbits you'd like your colleagues to know?
I'll speak on behalf of Jane because she did the paperwork for Medicare and Mass Health and getting that set up. That was the biggest, I think, hurdle to get our program going so we could be reimbursed. Because our very first year in 21, we weren't able to provide flu and COVID vaccine just because we didn't have that paperwork in place. But for 22, we were able to. And Jane was just like, oh, it got kicked back again. So like she worked through all those, like had to, I don't know how many times she went to the town of Lee. I need this, I need that. And that's the biggest hurdle. But once you clear that hurdle, it's a way to be self-sustaining. Be able to purchase vaccine, you get reimbursed, and then if you do, in-home vaccinations, there's more money for that too.
Yep.
So that makes that right there, that's huge. The extra money that you get from that reimbursement. I would say that's the biggest hurdle is that upfront paperwork. Yeah.
To be specific, the extra money that you get for the home visit is specific to Medicare.
Yes. Yes. Sorry.
Just to be specific. I want to give a big shout out to Jane Smith for helping other health directors set up their Medicare paperwork. We so appreciate you, Jane, for doing that. Lori, what pearls or tidbits did you work through and do advise other folks to kind of not give up on?
I think for us, the key was really figuring out the referral system and how that was going to work with 3 diverse municipalities and 3 different school districts, how they wanted to work with us. So figuring out the secure spreadsheet, figuring out a way to get that to work for everyone. And then also for us, really key has been having this remote outreach team that can kind of do the background work of calling people and setting up appointments. I honestly couldn't do it without them because it would just, I would be swamped with administrative stuff. So
that's great that you have that support. Taylor West is the health director in Southborough, and she's asking, does a regional program need to be hosted by a PHE grant holder town? So like a host community? No. Becoming a vaccine provider with the state vaccine program is totally separate from PHE. And I don't know if Taylor, which region of UMass, which consultant you're assigned, Taylor, but I would encourage you to reach out to your UMass public health nurse consultant. They've been helping people organize regional vaccine programs. It's been going really well. I think that the more towns that get involved in a regional program, the less likelihood there would be for vaccines to expire, for there to be waste. There would be less duplication of efforts. There's just so many reasons why a regional program is optimal versus one municipality with only low to moderate need trying to take on an entire program themselves. And both programs that we're hosting here today, both Lori and Jill's programs, are multiple municipalities. Between the 2 of them, it's 14 suburbs and 2 cities that they're serving. Wendy Judd on the Cape asked, how are you doing consent? And I think that Lori, she was asking you how you're getting consent.
Consent to vaccinate their kids? Like, what is she referring to specifically?
I think that's what it's referring to.
I mean, we don't do clinics at the school, so the families are bringing their kids and filling out paperwork when they're with us. And obviously when they make the appointment, we're getting consent verbally when we're making the appointment in color. So
wonderful. Thank you. I want to thank you all for coming and sharing your programs today. I think your colleagues will have appreciated hearing about your work too. You both have accomplished so much in such a short period of time, reached so many children and families, and made such a big difference in not only the lives of those children, but the public health in your region. And it's just a very, very impressive. Kathryn, do you have any last thoughts?
No, but just to echo that you are doing wonderful work, and everybody here really is doing wonderful work. And if this is something that you would like to provide additional vaccine services to kids in your communities, feel free to reach out to our program and we'll be able to walk you through the steps that are required.
Thank you, Kathryn. And specifically, should they be which group in the division should they be reaching out to if that's the step?
The vaccine management unit. They are the ones who will know the ins and outs of being a vaccine provider, will answer any questions, any concerns you might have, let you know everything that you need in order to set up a successful program.
Thank you, Kathryn, for presenting about the immunization division today and for all the work you do to support local public health. And Lori and Jill, thank you for presenting your work today. Really been really fabulous, everyone.
Thank you.
All right, just have a couple closing and next steps for everybody. Just reminder, we will be sharing out the recording and all of this information in our next FPHS newsletter. And we just thank everybody for joining us today. And we will be coming back with our next FPHS later this fall, so stay tuned for more information about how to attend and the upcoming topic. Thank you.